How to take lifestyle precautions for hemophilia. Hemophilia is a rare genetic condition in which a person's blood does not clot as it should. This is due to a lack of clotting proteins in the blood, also known as clotting factors. In order to manage this condition, and to avoid health problems associated with this condition, you should make some lifestyle changes if you are diagnosed. Lifestyle precautions combined with proper treatment can help ensure that your hemophilia is manageable. Method 1: Staying active while avoiding risks. 1. Exercise regularly. Even though it may seem like you should stop exercising when you are diagnosed with hemophilia, you actually shouldn't. Exercise strengthens muscles and helps to limit spontaneous bleeding and joint damage. These things can be serious health problems in hemophiliacs, so exercise is actually an important part of staying healthy. Do exercises that use regular range of motion and do not cause pain in the joints, as bleeding in the joints can be a problem with hemophilia. These exercises can include gentle stretching and balance routines. Simple exercises that use body weight, such as push-ups, are good. Stop immediately if you feel pain. Avoid doing exercise that can be dangerous or cause injury to you. 2. Participate in a non-contact sport. There are some sports that a hemophiliac can do, but many can pose a risk to the person's health. When picking a sport, pick one that will limit the risks to your health but will bring you satisfaction and will give you exercise. Sports that can be okay for a hemophiliac to participate in include swimming, badminton, cycling, and walking. 3. Minimize risky sports activities. All high-contact sports, such as rugby, football, and boxing, should be avoided. These sports can lead to external and internal injuries that can lead to excessive bleeding and even death. You will need to weigh the benefits and the risks before participating in a sport. Additionally, you should take the seriousness of your hemophilia into consideration. 4. Use protective equipment. If you are a hemophiliac and you want to stay active, it's important for you to protect your body from impact. Use protective equipment, for instance knee pads, while exercising or playing sports. This type of equipment can protect you from a potentially devastating injury. Other protective equipment that can be great for a hemophiliac to use includes helmets and elbow pads. Also, covering up your skin so you do not receive lacerations can be a good precaution for a hemophiliac. Method 2: Avoiding certain medications. 1. Do not take NSAIDs or aspirin for pain relief. Both NSAIDs, such as ibuprofen, and aspirin limit blood clotting, which is bad for a hemophiliac. NSAIDs limit the ability of platelets to bond together and aspirin thins the blood. It is safe for a hemophiliac to take acetaminophen, Tylenol, for pain relief. Acetaminophen does not impact the blood's ability to clot. 2. Do not take drugs that could cause blood thinning. In addition to regular over-the-counter pain relievers, there are some prescription medicines that can promote thin blood or limit clotting. These should be avoided by hemophiliacs as well. Make sure all healthcare providers are aware of your condition so they do not prescribe these medications. They include heparin, warfarin, Coumadin, clopidogrel, Plavix, prasugrel. 3. Discuss all over-the-counter and prescription medications with your doctor and pharmacist. If you are a hemophiliac, you will need to discuss your condition with all doctors and medical professionals that you consult with. This means that even if a doctor is not treating your hemophilia directly, they should be aware of the condition in case of a prescription medication being prescribed that could impact your clotting as a side effect. If your doctor prescribes a new medication, you can simply ask them, will this medication have any impact on my hemophilia? You could also say, I just want to be sure this treatment will not cause my hemophilia to worsen. Above all, just be clear and to the point. In most cases, a doctor will consult your medical records before treating you, thus knowing that you have hemophilia. However, it is always better to be safe than sorry when it comes to risks to your health. Method 3: Caring for your health. 1. Practice good dental hygiene. If you have hemophilia, having bleeding gums can be a serious health issue for you. With this in mind, take the time to care for your teeth, so that they stay healthy, and get regular dental care. Find a dentist that is experienced with treating patients with hemophilia. They will have a better understanding of the condition and will give you medication that can limit bleeding during treatments. 2. Follow treatment and care directions. Follow your doctor's directions for treatment and preventative care. This includes having clotting factor replacement therapy when necessary and having regular exams to assess your condition. How often you go in for factor replacement treatment will vary. Some patients will need to go in every day if they have a severe case of hemophilia. Others will have to go in very rarely, perhaps once a year, if their condition is very mild. You will also want to have regular vaccinations in order to avoid illnesses that could be very serious due to your hemophilia. 3. Wear a medical alert ID bracelet. Another option is to carry a card, but you should always have something on your person that indicates you have hemophilia. This way, if you are involved in an accident or there is an emergency, medical personnel can treat you appropriately. The card will have more room and can inform them of any treatments you are on, medications you take, and any allergies. 4. Get immediate medical care. If you become ill or have an injury that won't stop bleeding, you will need to get medical care right away. If you have hemophilia, you need to be proactive about your health and treatment of health problems. Even a bruise on a person with severe hemophilia can become a serious health issue if it goes uncared for. You will need to learn when you need medical care and when you do not. This largely depends on your level of hemophilia and the treatment that you are receiving for it. Look for signs of bruising and pay attention to bleeding that doesn't stop. Also pay attention to signs of internal bleeding, including bleeding on the brain. These include a persistent headache, weakness or swelling in the limbs, vomiting, lethargy, and inability to move or bear weight. 5. Take the proper precautions when traveling. If you are planning to travel, you will need to do some additional preparation first. Find out where hemophiliac clinics are located around your destination and keep their contact information handy. Bring extra medication, talk to your doctor if you need them to prescribe extra, and carry with you written instructions on dosing of your medication and what emergency medications you require.